gender dysphoria in children is a topic that is coming up more recently. Today, we would like to educate our viewers about gender dysphoria in children. So what exactly is gender dysphoria? Gender dysphoria is the distress caused when a person's gender identity is not congruent with their assigned sex. In other words, an individual with the biological characteristics of a male may feel that he is actually a female and may begin to identify in this way. This condition causes significant distress or impairment in social, occupational, or other important areas of functioning. Gender dysphoria is a rare disorder. Gender dysphoric children have the potential to suffer a great level of trauma because of what they are dealing with internally and because of societal pressures. Today, we are speaking with two researchers, Dr. Lynn Griffin and Dr. Molly Phillipson, who just got back from doing research about gender dysphoria in children. They are here to tell us more about the research on gender dysphoria in children. Can you tell us about your research?
I went to Amsterdam and studied children with gender dysphoria, and Dr. Phillipson went to Toronto and did the same. We observed the behavior of children playing and interacting with their peers. We found that gender dysphoria can be manifested in a variety of ways. These include strong desires to be treated as the other gender, wanting to get rid of one's sex characteristics, or strong feelings towards wanting to be the other gender. Some of the experiences of children with gender dysphoria include behavioral and emotional problems, social ostracism, peer rejection, bullying, teasing, and depression. There's a high comorbidity of other mental disorders such as depression. Increased feelings of loneliness, hopelessness, frustration, impulsivity, and self-harm are also possible.
What are some of the treatments available for gender dysphoria in children?
For children who have not reached puberty yet, treatment is primarily psychological and psychosocial. The child and his or her parents will first need to go into therapy. The child and the parent may have separate sessions or attend sessions together as a way of gaining information about diagnosis and treatment options. Group therapy and support groups may be available for parents as a means of support. When children get older, other treatments include puberty suppression, hormone therapy, and sex reassignment therapy. These cannot happen until the child is a certain age and has undergone psychological evaluation.
When is the best time to begin treatment?
The best age for gender dysphoria treatment has not been determined. However, studies show that suicide attempts and completions were lower in children who received early treatment. Also, children who received early treatment had a reduction in depression, anger, and anxiety.
Tell us about this social ostracism. Why do you think that children with gender dysphoria are treated differently?
This is multifaceted. A lot has to do with the prevalence of gender binary in society, as well as issues in the family. A lot of it also has to do with education.
What can be done about this?
Education is very important. This is why we are making this video. When people are educated, they are more likely to be empathetic and understanding of other people. When we are educated, we are less likely to respond with ignorance and wrongful judgment. We must understand the difficulty that individuals with gender dysphoria go through. Parents and other family members should go to therapy with that child to understand his or her feelings. The parents may want to have therapy themselves since it is difficult to accept the fact that their little boy or little girl identifies as the opposite gender.
Well, there we have it. We've now learned about this very important topic. For more resources, visit the American Psychological Association at apid.org and search transgender child.